Some illnesses are just impossible to miss, right? A broken bone, a raging fever, they practically scream for attention. But then there are the other kinds of illnesses, the ones that don't. Yeah, depression doesn't shout. It's much quieter than that. It kind of whispers and creeps in, and it can slowly change absolutely everything about how you think and feel. So today, we're going to pull back that curtain and really get a look at what's happening with what clinicians call major depressive disorder. And to really get this, we're not just going to throw a bunch of charts and data at you. No, we're going to follow a story. We're going to meet someone we'll call Amir. His journey is going to be our map, guiding us through both the clinical facts and, the real human experience of this incredibly complex condition. All right, so before we dive into all the science, the brain scans, the neurotransmitters, all of it, let's start where depression actually begins for the person living it. It starts with a feeling, a fundamental shift in the way the entire world feels. For Amir, it's like someone turned down the color saturation on his whole life. Food, it's just bland. His favorite songs, they're just noise now. And those hobbies he used to love, the things he'd get lost in, now they just feel like a total chore. And look, this is so much more than just being sad. It's a profound, deep loss of joy in anything. So that profound, heavy feeling Amir's experiencing, that's actually the starting point for a clinical diagnosis. So let's kind of pivot here from his personal world to the professional one and see how a clinician would go about formally identifying major depressive disorder. This is square one. To even consider a diagnosis of MDD, a person has to be experiencing one of two key things for at least 2 weeks straight, either a consistently depressed mood or that total loss of interest and pleasure in things. Clinicians have a word for that: anhedonia. And Amir's experience? It checks that second box big time. But those two core symptoms are rarely the whole story. To get a complete picture, clinicians use a kind of checklist to look for a whole constellation of other changes. It covers pretty much everything: sleep patterns, appetite, energy levels, even the ability to concentrate. It's the pattern of all these things together that leads to a diagnosis. And when they go through that checklist for Amir, they land on a specific number: 7. That's right. 7 of these key symptoms persistently making his world heavier every single day. So this isn't a borderline case. It's a clear clinical picture of major depression. So once that clinical picture is clear, the focus immediately shifts to the most urgent priority there is: safety. Because with a diagnosis of major depression, there is one question that absolutely has to be asked above all others. And when it comes to safety, let's be crystal clear. It is the absolute first priority, period. Clinicians are trained to look for very specific red flags. A prior suicide attempt is the single strongest predictor, but they're also assessing things like substance use, profound feelings of hopelessness, or whether someone has a specific plan. If that risk is high, the immediate goal is simple: create a safe environment, which very often means hospitalization. Okay, so we've seen the symptoms from the outside. We've talked about what it feels like. Now let's go deeper. Let's pop the hood and explore what's physically happening inside the brain to create this whole experience. And this right here really gets to the heart of everything we're talking about. There's this persistent myth that depression is just a feeling, or a sign of weakness, or a choice. But the scientific reality couldn't be more different. It's a biological disorder. It's about chemicals, circuits, and hormones. It is an illness, not a character flaw. And here, we can start to connect the biology directly back to Amir's symptoms. The classic theory points to 3 key brain chemicals. Low levels of serotonin are linked to his low mood. Low norepinephrine helps explain his constant fatigue and low energy. And low dopamine? That connects directly back to that feeling of anhedonia, the inability to find joy or pleasure in anything. But it's not just about invisible chemicals. We can actually see the effects of depression on the brain's activity. Brain imaging shows this really clear imbalance. The amygdala, which is kind of like the brain's fear and negativity center, becomes overactive. At the same time, the prefrontal cortex, the part that's supposed to be our hub for emotional control and decision-making, becomes underactive. This isn't just a feeling. It's a visible, physical change in the brain's wiring. So, if depression is biological, it stands to reason we can treat it biologically. So let's turn to the path to recovery and see how this all builds towards a real solution for Amir. The first-line medical treatment for a lot of people is a class of drugs called SSRIs. Now, that sounds complicated, but the idea is actually pretty simple. Remember how low serotonin was linked to low mood? Well, these medications basically work by increasing the amount of serotonin that's available in the brain, helping to regulate mood. So, following his diagnosis, Amir's doctor starts him on sertraline, one of the most common SSRIs out there. This is the first step on his path to feeling better. But, and this is a really big but, it's not always a straight line. And this is such a classic, critical moment in treatment. After 2 weeks, Amir feels no different at all. He's frustrated, he's feeling hopeless, and he's thinking the medication has failed. But this is actually incredibly common, and understanding why is absolutely key. This timeline is so crucial for anyone starting these medications. It takes time for the brain to adapt. The first couple of weeks, you might even get side effects with zero mood benefit. Real, subtle improvements often don't even start until around week 4, with the full therapeutic effect sometimes taking 6 weeks or even longer. Patience really is part of the process. And for Amir, that patience pays off. Around week 5, he starts to notice a shift. The music doesn't feel so empty, he's got a little more energy, the world is slowly but surely starting to regain its color. Recovery is happening. Ultimately, Amir's story shows us something profoundly hopeful. Depression is a treatable medical condition. With the right diagnosis and the right treatment, people can and absolutely do get better. The key is recognizing it for what it truly is, a biological illness, and taking that first brave step to seek help. And that leaves us with a final thought to chew on. If we fully accept that depression is a disorder of the brain, just like heart disease is a disorder of the heart, how does that change everything? How does it change the way we talk about it, the way we treat people who have it, and the way we support them on their path to recovery?